Hello there, my name is David Kraft and I'm a psychotherapist in London. Today I'm going to talk to you about OCD. OCD is a very complex condition which is very difficult to treat. Patients who suffer from OCD, I've jotted down some notes here so I can be as efficient as possible. They have a rigid personality structure and their lives are dominated by thoughts and actions which are repetitive. Thoughts are referred to as ruminations, where people think about a motive time and time again. I must do this, or I'm worried about such and such, and it goes round their heads all day long. These are obsessional thoughts. And the repetitive actions can take all sorts of forms, but they're like rituals. So somebody can't leave the house because they need to check the locks and the taps, check the showers off, and so forth. And this can be really debilitating, and it can take people sometimes between 15 and 30 minutes to leave the house. And if you miss one of the checks out, you've got to start right back from the beginning. People check the same thing again and again and again. They know that they've checked it and the tap's off, but they feel they have to check it a number of times in order to reduce their anxiety. And of course, this reduction of anxiety is short-lived. Other examples are checking gas taps, water taps, plugs, the cooker, locks, and so forth. So OCD can present as an obsessional fear of vomiting, for example, and people go to lengths in order to reduce the possibility of vomiting, and contamination. So some people are afraid of contamination and germs and do anything to avoid this. So they wash their hands obsessively, and they touch things with gloves on. And it can develop into using plastic plates and not using cutlery in public and so forth. And this can have an effect on going away, eating out, and it causes all sorts of problems. In every case, OCD, people know that they're doing something obsessional, but they can't stop it. And some people are superstitious and they'll do things in order to reduce getting bad luck. So there are all sorts of dynamics of OCD. A lot of people that suffer from OCD are resistant to hypnosis, so it's my job to reduce that resistance using various techniques. One technique that I use is doing the opposite to what I want to do. So it's a paradoxical intention. However, some people find hypnosis very helpful in OCD, and we do very nicely together. But in all cases, individual psychotherapy is indicated. It's not just using hypnosis. You need to iron these problems out and look at the source of the problem, these obsessional thoughts, right back to childhood. And it's important not to exert any pressure. The more pressure I exert on trying to get rid of this, the worse people get. So I am very non-judgmental, and the approach that I use helps people get rid of these problems one by one in your own time. And that's the key to the treatment. The OCD is sometimes very difficult to treat, as I say, so I don't give guarantees on number of sessions, but a lot of homework is needed, and if you do the homework tasks, the behaviour tasks, it helps the work that we do in psychotherapy and can reduce the number of sessions indicated. My name is David Kraft. Thanks for listening. My numbers are below. One number is my Harley Street number, one number is my work mobile number. And then, of course, if you don't want to ring me, you can certainly email me. These numbers and emails are for GPs and specialists, but also for individuals who wish to book an appointment. Many thanks. Bye-bye.